Hi, I'm Catherine Ferguson and I'm a fertility nurse. I'm going to explain to you how to prepare and administer your Gonasi injection. Firstly, Gonasi is best kept in a dark, cool area such as the back of a cupboard. Inside the box is a large needle with a green base, a smaller needle with a grey base, a vial of powder and the syringe containing the solution. Start by opening all of the equipment so that it is easier to assemble as you go along. The needles are opened by twisting the paper seal. Fasten the syringe to the green needle by simply pushing the two together. Take the medication vial and remove the plastic cap. Aiming for the middle of the rubber bung, push the needle through. Inject all of the solution into the vial and the powder will dissolve straight away. Next, again ensuring that the needle is facing towards the bottom corner of the vial, draw all the solution out. You now need to swap needles. Remove the green needle by twisting from the bottom and replace with the smaller grey base needle. Gently flick the syringe to force air bubbles to the top of the solution and then push the plunger upwards to expel any airspace until a small drop of solution is seen at the top of the needle. Locate the area to inject by placing approximately 3 fingers below your belly button and pinching the skin in this area. Insert the needle at 90 degrees and push down the plunger until all medication is administered. Once empty, hold for a few seconds to allow absorption and remove the needle. A small drop of fluid or blood is nothing to worry about. And that's it.